helping people who don't have jobs to find jobs.
Helping people.
I really don't know.
Help patients during their recuperating stages.
So many people don't know what occupational therapy is. They think it's something to do with someone's occupation or helping people. This is correct, but occupational therapist is a much more complex and unique health profession. Occupational therapy is the aim of enabling individuals to be able to participate in occupation and occupational roles that are meaningful and purposeful to them. An occupation can refer to three main categories. Someone's self-leisure activities such as dressing, feeding or washing. Leisure activities which include things that you enjoy. And then there's productivity. Occupational therapy works in a client-based practice. So this means that they work one-on-one with the client. They need to make sure that they know all their interests, values, daily activities, which leads them to create an occupational profile about them. By making this occupational profile, they can make occupational-based goals. So these goals need to make sure that they're meaningful and purposeful to that person. So who do you think occupational therapists may work with?
I think they'd probably work with children with autism or people with learning disabilities.
Occupational therapists work with infants right up to death. So this may include paediatrics, people in aged care facilities, mental institutions, and also people with behavioural problems. So based on what I said before about occupations, such as self-care, leisure and productivity, what are some occupations that are meaningful and purposeful to you?
Probably sleeping and playing hockey.
So let's say, for example, sleeping. Would you find sleeping a very simple occupation to you? You don't really put very much thought process into it.
No.
Okay, imagine if you were in a car accident. You now have become disabled from the legs down and you're in a wheelchair. Sleeping would now become a harder occupation. So the way an occupational therapist would help in this situation is by going to the client's home as well as their workplace. They would also have to assess whether the client is able to get out of the wheelchair to their bed. If the patient is still having trouble, they would install handrails on the wall next to the bed so that the person in the wheelchair can use their upper strength to pull themselves out from the wheelchair into their bed. Now that I've told you a bit about occupational therapy, a brief description, the types of people they might work with, and the environment they may work in, someone asked you what occupational therapy is now after the video, what would you say?
It is a lot more in-depth. You actually learn about the patient, you get to know the patient, you work with them, and it's not what I originally thought. It was just helping someone to get a job. It's helping their everyday lives.
Would you say that this video has made you have a clearer understanding of what occupational therapy is?
Yeah, definitely.
So it was a success?
It was.